Bladder health is so important for pelvic health and your pelvic floor muscles. So we're going to go over some of basically I have a little handout called a happy bladder likes. And so I'm going to give you what the happy bladder likes to do, and I'll give you some common scenarios of mistakes and issues that I've seen people have over the years as a result of some of these bladder habits. And so it's very simple to think about changing some of these bladder habits, but sometimes it's a lot harder to do it. So for each one of these habits, I actually have resources and training on how to basically get your pelvic floor and get your bladder trained to do the right thing at the right time. But like with everything else in this challenge, this is an overview to give you an idea of where to start and where your baseline is. And so I would also encourage you to pull out your bladder diary and also that APFQ that you did at the beginning to kind of check yourself, do a self-check. All right, so a happy bladder likes water. So many times I hear, oh, I don't drink water because I'm afraid that I'm going to leak. But the opposite problem can actually happen if you don't drink water. So your bladder is like that water balloon. As it fills, it expands. If you aren't drinking very much, then that urine inside your bladder is going to be very concentrated. That can actually aggravate your bladder and in some cases cause urinary urgency, frequency, and maybe even leaking. So think about water. Also, so many people drink other things. And I'm not saying you can't drink anything like coffee or tea or soda or orange juice. All those things are fun and they add, they can add quality to our lives, right? We enjoy them. Also, adding alcohol to this list. But all of those things can aggravate the bladder, even just like sparkling water or some of the flavorings that we put in water. So be mindful of what you're drinking. And if you notice that after you drink something that you have urinary urgency, frequency, or leaking, then you might consider reducing or eliminating that substance. Okay, so I'm going to just give you a personal example. When I drink coffee, I can tell that I have an increase in my urinary urgency and frequency. Generally, I could go 5 or 6 hours in between trips to the bathroom and not have any problems, although that's bad. I'm going to tell you why in a minute. But when I drink coffee, especially if I had 2 cups, I'm going to notice within usually an hour and a half, like, oh man, it's kind of uncomfortable. I feel like I need to go. And so just recognizing that there's that cause and effect. Does that mean that I need to stop drinking coffee? It's up to me. If I drink it occasionally and I have those symptoms occasionally and they're not bothering me and it's not creating any long-term problems, then I don't see an issue with it. But just understanding that, especially if you're having urgency, frequency, pain, and leaking, that these substances can create some problems. Okay, a nutrient-rich diet. There are, this also could be its whole webinar on just things that you eat that could be a dietary irritant, and then also things that you eat that can keep your bladder healthy. And so I have some resources on that, but just kind of an overview would be some of the things that may cause bladder irritation would be foods that contain dairy, tomato-based products, hot, spicy foods, citrus foods, pineapple, foods that are high in the acidic content that can cause that bladder to kind of spasm and want to push out the urine before you really need to. So that can cause some bladder irritation. And then we want to focus on foods that help us to poop too. In our next lesson, we're going to talk about bowel health, but you want to try to target 25 to 35 grams of fiber a day. So really looking at your fiber, trying to get a lot of fruits and vegetables, whole grains. These are things that are likely to have more fiber and help you poop, and pooping helps your bladder. regular exercise. So the bladder also likes regular exercise. So make sure that you're incorporating a walk or whatever you like to do into your normal daily activities. Ideally, at least some cardio 3 times a week, 20 to 30 minutes would be the target. Healthy pelvic floor muscles, which is what we've been talking about all month long. So keeping those pelvic floor, keeping or getting those pelvic floor muscles healthy. Coordination. So this is where you cough or sneeze or laugh or jump, and we need those pelvic floor muscles to activate in advance of that activity. So we call it, a simple little phrase is squeeze and sneeze. If you've been around a while, you may remember back when we would sneeze or cough, we would cover with our hand, right? And that was like an automatic response. You feel that sneeze or cough coming on and you cover. And then we converted to doing it in our elbow, which makes sense, right? Because then, you know, you have all these germs that you just kind of spit onto your hand. So we now are doing it this way. And you had to relearn this activity. And the more you do it, the more you're reinforcing this activity. So every time you feel that cough or sneeze coming on, you're doing the elbow. So the same concept applies with the pelvic floor muscles. So we want to squeeze and sneeze. To illustrate this, I have my balloon. And so let's pretend like we have a fairly full bladder and we feel that sneeze coming on. And so what's going to happen is that these pelvic floor muscles are going to squeeze. You're going to physically squeeze these extra hard before you have that sneeze that presses on that bladder. Okay, so coordination is important. Now we have a little infographic here of the bladder filling. And as you can see, as it fills, so these are your pelvic floor muscles. This is your bladder outlet, and here's the actual bladder. And then around the bladder, you have another muscle, which is an involuntary muscle. So your pelvic floor muscles are voluntary, meaning you can squeeze and they should do what you tell them to do. And then when you relax, they should also relax. Many times with urinary urgency and frequency and bladder pain, what we see is that the bladder fills, but at this point right here, or maybe at this point right here, you're getting really, really strong urinary urges and to go, you may be getting pain. And so you start getting in a habit of going before your bladder really fills. And what that can set you up for is that these little sensors, when your bladder expands, you have stretch receptors on that bladder that send a message to the brain that says, hey, we're going to need to go pretty soon. And the more you kind of give into that sensation of going before you really need to, before your bladder really needs to, the more you're going to reinforce that habit. And so that's also something that we call just in case peeing or jickers. So I don't really like that term, but just in case, okay? So if you're consistently peeing just in case, oh, I'm gonna go to the grocery store, so I'm gonna pee just in case. Oh, I'm gonna go here, I'm gonna pee just in case. Oh, I'm at the mall, there's a bathroom, okay, I'm gonna pee just in case. If you're that person that's consistently peeing just in case, or you're peeing before that bladder fills, then you can get those little stretch receptors become hypersensitive, and then it can actually even be painful to fill past that point. So that's kind of the concept. We want the bladder to fill. Now, on the flip side, we also want the bladder to empty. So the bladder, you can see in this infographic here, the bladder empties. This is a little bit misleading because there is some urine. It's called the post-void residual. There is a little bit of urine that still stays in your bladder, but it's a very small amount. And so if you have a lot of urine, let's say you urinate and you stop there, you feel like you're done. This is something we call incomplete emptying. And so we want the bladder to empty, pretty much all the way, right, until you get to that post-void residual. And so that's important because if you have that urine living in there on a long-term basis, there are other problems that can occur there. Now, empty every 2 to 4 or 2 to 5 hours. So you really don't want to go under 2 hours between trips to the toilet or over 5 hours. Many occupations will hold their urine too long. Okay, and this can actually set up some severe long-term problems for your bladder. So like I told you earlier, like I can go 5 or 6 hours easily between trips to the bathroom. That's not necessarily healthy. Okay, so my target is 4 to 5 hours, emptying my bladder every 4 to 5 hours. If I want to go every 3 hours, that's fine. Rarely do I ever need to go 2, but if you are like a healthcare provider or a bus driver or a teacher or in food service or, the list goes on and on for the types of occupations and the types of things that we do that we may not get a regular toilet break. You've got to self-advocate. Your employer is, if they haven't done it already, they're unlikely to be your best pelvic health advocate, right? So understanding that you need to empty that bladder every 4 to 5 hours, setting yourself a timer to remind you, and that is within your rights as a person and a human being that you need to go empty your bladder. I recently went on this trip to Belize, a medical mission trip, and I was with a team of urologists. And so I had an opportunity to ride with them for like 2 hours from the place where we were to the airport. And I'm like, hey, I want each of you to give me like your top 3 pelvic health prevention tips. What do you want people to know? And it was an amazing experience that I was able to have this time with these world-class urologists. And their first tip, honestly, was don't hold it too long, because what they're seeing in the clinic is that people later in life have basically dead bladders. Okay, so remember that bladder expands, and then when it's time to empty, that involuntary muscle around the outside of the bladder needs to squeeze to empty the bladder. And people are getting to the point where that bladder isn't squeezing. And so what happens then, if that bladder isn't squeezing to empty, a lot of people are having to get catheterized. So a catheter is where you have, this tube that goes into your bladder and you have a bag for your urine. So they're seeing like 40 and 50-year-olds. I'm 49, I'm almost 50, that are having catheters because they've had such poor bladder habits in their life and they've been holding it so long. So I know this lesson is taking a long time, but I hope that was valuable. Don't hold it too long. Is doing it now and then the end of the world? No, it's habits. It's habits that make up who we are. And so consistently doing it over time can cause problems. Oh, actually, then I'm going to elaborate on the under too. So what we see a lot in pelvic physical therapy is urinary urgency and frequency. So I've had patients in my office that are going to the bathroom every 15 or 20 minutes throughout the day. They're going 20, 30, sometimes even 40 times to the toilet. What kind of quality of life is that? What can you accomplish in your day? Are you able to leave the house? Are you able to go to work? Are you able to go to the grocery store? Can you travel? Can you go to a movie? Can you enjoy time with your friends? And then that's not even talking about nighttime, which we're going to get to. So, we do things called bladder retraining. And so training that bladder to hold longer so that we can get them up to the point where they're voiding every 2 hours. And, everyone starts somewhere, and you're not going to jump straight from 20 minutes to 120 minutes. So it's a gradual process, but it is possible. Okay, daily poops. So pooping every day is really important for the bladder. Your pelvic organs, your pelvic bowl is only so big, right? I mean, you only have so much room in your pelvis. And so there's not a whole lot of space in between your bladder and your rectum. And if you have a very full rectum, that can actually press on the bladder. And that's one of the leading causes of bedwetting in children as well. Sleeping, again, I'm seeing people that are going 8 and 10 times a night to the bathroom. What kind of rest are they getting? They're not getting rest. So the ideal scenario is that if you're under 65 and you're not pregnant, that you go 0 to 1 time a night. So if you get up 1 time a night, no big deal. But if you're regularly going 2 or more times and you're not pregnant or over 65, then looking at doing some bladder retraining. A healthy mindset. The bladder is very sensitive to stress. And so having a way to consistently deal with stress in our lives is important, whether it be exercise, meditation, prayer, yoga, stretching. I mean, the list goes on and on, but finding a way for you to consistently and healthily deal with the stress that comes in your life. Everyone has stress. I'm not saying don't be stress-free. That's impossible. But how do you deal with the stress that you have? Having that healthy mindset. Support. I think this is something that's underlooked quite a bit. Going back to the bladder here. So this, number one, the urethral canal itself can start to collapse into that vaginal canal. And so that's pelvic organ prolapse, or the bladder itself can drop into the vaginal canal, and that's pelvic organ prolapse. And so using some of the techniques that we talked about earlier with external support or internal support can make a difference even with leaking. In fact, there was a study, I don't know, 10 or 20 years ago, my pelvic floor hero, Dr. Carrie Bow, did a study of athletes. And so a lot of times high intensity, high performing athletes, especially like gymnasts and some of the other things that are in high impact sports, have an increased incidence of leakage. Urinary leakage. And so she did a study showing that inserting a tampon vaginally during that activity actually helped to reduce leaking. I can't suggest that to you because that's an off-label use of tampons, but we talked about some other options for intravaginal support, and I just want to introduce that concept. Okay, we're nearing the end, and then we have confidence. So knowing that you have the power, knowing that by doing these tips and techniques and having these healthy bladder habits, that you can choose when and where you urinate. You don't have to be ruled by your bladder. You can be the boss of your bladder. And that's what I want, for you to have the control to choose when and where you urinate. And then regular checkups. So that's important. I would say, if you're going to a primary care physician or you're going to your OB or your GYN, just discussing bladder health. If you're having any pain, urinary urgency, frequency, urinary tract infections, leaking, make sure you're talking about it and not just kind of absorbing it and trying to hide it, or feeling like they don't care or it's a taboo topic. Your healthcare provider is there for you, and if they don't listen to you, find somebody that does. Okay, before we close out the bladder health, I wanted to go over just basically for each of these items here that we went over, these 14 points, I have a small explanation. So this is a handout that you can print out and you can work on it. Okay, so use that, share it, and be the bladder expert in your family. Talk about it. You never know what someone else is experiencing. And so you could be that person that helps somebody else have better bladder health and brings them hope and help. So that's it for a healthy bladder. If you have any questions, drop them below. Or if you have any tips that I haven't mentioned, because by no means is this an all-inclusive list, drop them below. I love the dialogue that you guys are exchanging in and all the comments that are coming in. Keep them coming. We're nearing the end of our challenge, and I really appreciate you guys being here. Let's go to the bowels.